Well, let's talk about the good stuff. Successful weight loss surgery, and this is true for most people. Most people lose, and that's more than 95% of people, lose between 50 and 80% of their extra body weight. That's the amount that you are over your ideal body weight. So if you're 100 pounds overweight, most people will lose between 50 and 80 pounds. If you're 200 pounds overweight, most people will lose between 100 and 160 pounds. That still leaves you not at ideal body weight. However, health-wise, as we mentioned before, that's generally not an issue. And I will tell you that ideal body weight in our current society really looks a little bit too skinny. Surgery is very dramatic. We've discussed risks and benefits of surgery. We talked about getting to and through the OR. It's the time when you'll be worried, your family will be worried. And it is a big deal. However, what's really even more important long-term for your success is just using the tool later. It's not what happens at surgery. That enables you to have that tool. But I cannot stress how much just you using the tool really helps. That involves managing the fullness, satiety as we call it, having daily physical activity, starting meals with protein so that you feel full. Protein gives you a better sensation of fullness, and separating liquids and solids. This is the one tricky area that a lot of people feel like is going to be difficult for them, but rarely is. Both of these tools are better used when you're not washing food through that small pouch. Sometimes even for gastric bypass patients, they feel so full with a couple of sips of fluid that they don't get adequate nutrition in. But for the most part, long term, it's about having that food stay in the pouch for a little extra while, and that means about a half an hour before and after meals. A lot of people are very concerned about this. They feel like they can't do it. You know, you can't go out to eat without them pushing fluids on you. It does take a little bit of learning and a little bit of practice to get your fluids between meals, but it really does help with that feeling of fullness. And I recommend even for people to sometimes try it. Even with a normal anatomy, it actually can help. If you go out where you eat a big meal and you eat the same foods that you normally eat, drinking, I'm a big Diet Coke drinker, a lot of people drink a lot of water, and you eat that meal without any added fluid, you will find usually that you're full at least a little bit sooner, sometimes a half a plate of food sooner, you know, at least 30% sooner for a lot of people, and that really does help. So it's not hard to do after a while, but it definitely is an adjustment. You do want to avoid sort of naughty foods. Again, I put avoid on here very deliberately. It is not a matter of being perfect. It's not a matter of never having chocolate again or never having a milkshake again. It's avoiding it. It's limiting the intake. Those foods, though, really do create havoc if you eat a lot of them in terms of driving your appetite up and down and creating insulin releases that make you hungry as well. For the lap band, adjustments really are critical. The tool itself sitting in there is not tuned automatically. We need to work with you to get the proper amount of fluid in it so that you do feel full after a small meal. It doesn't do the job by itself without having that fluid inside. We don't put the fluid inside for 6 weeks after surgery to let things heal into place. And then we do adjustments, usually 2 to 5 adjustments before people are feeling a good amount of fullness. And then we can, as you lose weight, we can readjust from there. Vitamins I mentioned before are very important for safety long term, especially for gastric bypass patients. And then finally, and very importantly here, support. That means support at home as best you can get it. Not everybody has that perfectly well. A lot of people's families have adjustment with them. A lot of spouses sometimes feel threatened temporarily, and you may actually have to reach out more to them to let them know that you still love them and that you may look different, but you're still the same person. And there really can be some family adjustments. And that is why having a support group, coming to a formal support group, is really helpful. To have a peer group as supportive and empathetic as we try to be as professionals, as your team member, your fellow peers, your fellow patients really can give you a lot of help, and you can help them as well in terms of sharing that journey. Not everyone's journey is the same, but even somebody who's having a different journey can give you good perspective. So what's the follow-up like after surgery? After gastric bypass, we're going to see you at least 5 times that first year, more the first 3 months, and then regularly every 3 months for the rest of the year. Then we see you at a year and a half, 2 years, and then every year after that for the rest of your life. With the lap band, there can be more frequent visits. A lot of people will only need 5 or 6 visits that first year, but if you need more adjustments, it can be an issue for people who have to drive or people who have busy schedules. It's usually not terribly hard, but just be aware that you may have more office encounters that first year. Lifelong, we can do band adjustments. People don't require them always, but it's not infrequent to see somebody back a few years later who just feels like they're getting a little hungry or a little sooner after meals. Put a little more fluid in and they're back and good to go. With the lap band, when we do adjustments, when we're getting at that port, especially early on, sometimes people who have a very thick abdominal fat will need to use either X-ray or ultrasound to get that needle in to that little port. It's not that small, it's not that hard to find, but just be aware that we may use an imaging tool to get it fluid in. Changes of surgery. With both procedures, you do need to chew food very well. If you swallow food too quickly or unchewed food, it can get caught, and it's not uncommon while people are learning how to live with these tools that occasionally they pick up the phone and they forget that they were eating a sandwich, and they look down and there's 2 more bites gone of that sandwich, and it's not uncommon. 1 or 2 times of spitting stuff up is not a terribly dangerous thing, but certainly people don't want to have it happen much. So remember to chew food. You don't want to be skipping meals. You want to have breakfast, you want to have lunch. First of all, because that regulates much better your feeling of fullness. You don't want to be deprived. You want to feel full, like you've had enough food all the time. But on the other side, you also want to eat meals so that you don't get behind and get malnourished. You cannot make up at dinner time for what you missed in terms of protein at the other 2 meals. So you need to get your protein through the day in order to get enough in. Hydration, getting enough fluid in can be a work habit for some people. It just takes some time to learn to drink fluid between meals in order to get enough in during the day. But it really is not just something that comes automatically. Protein and vitamins are priorities, and you have to treat them as important parts of your life. And then avoiding high-calorie liquids, especially with the band, because they really can go through and just be invisible calories.